not only in the pulp, for the tooth itself. Okay, sensitivity. Basically, dental hypersensitivity is, in simple terms, we'll call it as sensitivity. So, why this sensitivity? These are all the other names for the dental hypersensitivity. You can call it as cervical sensitivity, root hypersensitivity, segmental, or simply sensitivity, dental sensitivity, all this. So basically this sensitivity mainly occurs because of the fibers present in the tooth. Those includes the A fibers and C fibers, A delta and the C fibers. I'll explain it in detail about all these things in the next class. So basically dental hypersensitivity, mainly patients complains of dental hypersensitivity in the cervical region only, and in some cases the tooth gets elongated, or if the tooth gets wear off, occlusal portion also will cause sensitivity. So how will you manage the dental hypersensitivity and what are the etiology? Main important things are you need to know about what is meant by dental hypersensitivity and how the tooth sensitivity occurs in the tooth and what are the etiological factors. So at least tell me one etiological factor, common etiological factor for a hypersensitivity. You know any one etiological factor?
Enamel loss.
Caries.
Caries, of course, but it is not a common etiological factor. Cervical area, what you will observe in the cervical area? What you will observe in the cervical area, if patient gets sensitivity, which commonly in your house or your neighbors may also complain of sensitivity and ask you for a treatment. Advise some toothpaste. I'm having severe sensitivity in so and so region. Mainly because of gingival recession or cervical abrasions. Why they occurs means because of faulty toothbrushing or excessive forces used during toothbrushing. So I'll just show you those pictures. So see, can you see these pictures? Can you see? So
Yes, ma'am.
Yes, ma'am.
cervical abrasions, they occur because of mainly because of faulty toothbrushing or because of excessive force used during toothbrushing or the horizontal brushing techniques. Cervical abrasions or abfractions, they will cause removal of the protective enamel layer so that dentin gets exposed. So in the dentin, the dental tubules will be there, no? So because of the dental tubules, the air blast or water, whatever it touches, that sensation will be carried onto the pulp and causes sensitivity for the patient. So this is how our cervical lesions will look. Those include, this is the erosion, this is the cervical abrasion, and this condition is cervical or abfraction. So these are all the main causes for the etiology, and in some cases accretion on the occlusal aspect also will cause the sensitivity for the patient. So the main etiological factors are all these. So the treatment management part includes patient counseling regarding his diet or the brushing habits, and at home treatment that includes the advice of that includes that you should advise some desensitizing toothpaste and proper toothbrushing techniques, and finally if these two kind of treatments doesn't work out, then you have to go for in-office treatment. That is what you take in the clinics. Or if the lesion is also more, then you need to know about the in-office treatment.